After the coronavirus pandemic hit, most doctors' offices closed entirely, but many patients still need care and some need to be seen in person. James Pilcher shows how some practices are slowly reopening and helping lighten the load on emergency rooms.
After Harper Heid of Ross Township broke her wrist rollerblading, her parents struggled with what to do in this age of coronavirus.
But obviously the ER is the last place that I'd want to go right now with the quarantine and everyone else.
The Heids wound up taking their 9-year-old to Beacon Orthopedic. That practice is one of many in the area, slowly reopening to see patients both in person and virtually, with major precautions, of course.
One of the things that we at Beacon are trying to do is try to offload the emergency rooms and urgent cares, because someone has a fall and they have a broken wrist. They still need to be seen, but there's really no reason to go to the emergency room.
Beacon and other practices such as St. Elizabeth's Physicians in northern Kentucky have seen telemedicine visits skyrocket. A doctor there says the practice had 250 virtual visits all of last year. That number is more than 1,600 a day over the last month.
I think this is going to be here to stay. We've let the genie out of the bottle.
St. E's is also doing what Dr. Went called platooning, making sure that some doctors are at home in case an office is exposed, so there are backups for future visits. Most offices only allow 1 or 2 patients in a building at a time, and everyone is screened before entering, and staff wear masks and protective gear. Then there are the patients of physical therapists like Kathy Gunther, who still need in-person attention. Donna Georgie had her hip replaced in January and wants to heal properly.
It keeps me on track as far as being able to get stronger.
James Pilcher, Local 12 News.
And we're told that most doctors' offices are also requiring that visiting patients wait in their cars, have their temperatures taken before entering a building, and enter and leave through different doors.